Let's talk about the healthcare agenda now, because this is something that most people are familiar with, and a lot of people seem to be confused about it. Healthcare, it's not about reform, and the reason is the only way it can be reformed is to bring the system in sustainability or balance. Right now, Medicare is $34 trillion in debt. That's the amount of money that's necessary to carry Medicare for another 75 years. It doesn't account for increases in medical needs. How did we get here? We got here because we've been trained to be addicted to unhealthy diets and lifestyles. Pretty much everybody knows that if you lived off the grid, outside of stress, and outside of processed foods, you probably wouldn't even need to see a doctor. I mean, there's no mystery there. But how many people are really doing it? And how many people are already addicted to the system, so they're already addicted to the drugs. They have to have them to survive. It turns out that 15% of the US population needs Medicare to survive. If the Medicare or the medical industry fails, not only is it 15% of the people that are basically in trouble, but all the doctors, all the medical industry will collapse. That would drag our economy down instantaneously. We go into economic depression if the medical industry fails. That's why they're trying to support it to keep running. And it's a temporary fix. They can't fix the problem unless they pay back the $34 trillion. This is why they're not talking about it. You know, you've heard the $34 trillion number, at least some of you have. You ever hear anybody in Congress or Senate or presidents talk about it? They can't. If people knew how far in debt we were, there would be a revolution tomorrow. And I'm going to tell you that. Let's say the $34 trillion, let's say if we were to repay that money and make it sustainable. It would cost every person in the United States, man, woman, child, $106,000. That's what $34 trillion adds up to. Every child, there'll be people aren't even working, people are retired, $106,000 each to pay back the Medicare issue. And that's only to get it up to even today. But these are numbers that are going to grow as the population grows. There's nothing done to curb population growth. And I will say this, a lot of people are talking about the N1H1 swine flu virus. Anybody heard about some of the things that could be incorporated? Well, one of them is a birth control method. Whether it's true or not is irrelevant, but they know they have to do something. The only way we become sustainable on this planet is if we, like we talked about consumption, we either have to reduce consumption until the resources can rejuvenate, or we have to reduce the population. Okay, they know this. They know that we're unsustainable with the population right now. They know how many people are starving worldwide. And every time the economy gets worse, more people starve. Because when we buy things, it pays for that guy in South America or China or India who made that product. It's his salary. So when we're not buying stuff, they're not getting paid. And that's why we're already seeing the problem with riots, food riots, and inflation on food all across the world right now because the economy is just in recession. When this goes to depression, we have worldwide global famine. Instantly. It's already happening. And if you're reading the news and really absorbing the news that's out there, not just the rhetoric, you'll see that many cities are in major trouble. Medicare is scheduled to go bankrupt in 2017. Right now, it's paying out more than it's taking in. People are not getting health insurance as frequently because they're seeing that it's a lot of money, and if they take care of themselves, they don't need it. Okay, this is affecting the medical industry. They can't let this industry fail. If this industry fails, it takes down the entire U.S. economy, and when the entire U.S. economy goes, the world economy goes with it. So the only way that they can keep this running is A, keep Medicare running, and that just means for a short period of time because they know the system is all failing, and they're planning on letting it fail. But they just want to give the impression that they're doing something, and they want to give the impression that they are going to do something that actually works and fixes it. So what are they doing? You all heard of universal health care during the elections. They're not talking about it now. Right? That was their solution during the elections, and what that meant is everybody pays into the system, even the healthy people. Because they can't keep it going without everybody paying. They're going to force you to have health insurance. So now they're debating They know they don't have to come up with a solution. All they have to do is give the illusion that they're working on a solution.
Why do you think they dropped it? What didn't work about it?
Universal health care?
Yeah. What was
Because
that?
you can't force somebody to pay for health insurance. They knew that, but they rhetoricked about it. They campaigned on it, but it was never going to go over on the mass public.
So the Republicans did something good there.
Both Republicans and Democrats know what's coming economically. This is not a mystery. Look, if I can figure it out, I'm not a PhD in economics. Sure, I took differential equations and calculus in college, but this is straight mathematics. This is multiplication and division. We're not talking about long division here. Anybody could figure this out if they did research. And certainly people like the Federal Reserve and all those people, they have more MBAs on staff than probably most major countries. They use statistical analysis to project and predict what's going to happen in the future. They know this is coming. That's why they've got the North American Union all planned. They can't do anything about it. They can't fix it. I'm going to show you why when I tell you how far we are really in debt. What is Congress doing about this? This is really interesting. How many people know that 6 years ago, Congress passed a law to fix Medicare? Now we're 6 years into it. And then over the next 9 years, they were going to reduce the payment to doctors by 41%. That was necessary to bring Medicare into balance. And now we're 6 years into it. Every single year, they have mandated to wait and not make the reductions in payments. So here we're 6 years into this law, which they have not acted on at all. You wonder why? The medical system is essential for maintaining the economy. You need people to be sick, and you need them to be convinced that the medical industry is the only solution they have. And the government has been willing to sustain that to keep people in the dark about what's really going to happen. Keep people addicted to drugs. Keep people addicted to processed food. Keep people addicted to unhealthy lifestyle. That's been the campaign since World War II. And it's worked, at least for those people who are still addicted. Can Medicare be saved? There's no way they can pay back the $34 trillion, and they can't continue to pay Medicare, so those 15% of people aren't going to be there. It's the doctors go out of business as soon as those 15% can't pay the medical bills. So what I'm trying to get across to people is that forget about how we got here, other than the fact that I help you realize some of our own shortcoming that caused us to get here. But now it's time to plan for what's coming in 2010.